Menopause is a natural part of growing old. You don't need treatment for it unless your symptoms bother you. But it is a good idea to learn all you can about menopause. Knowing what to expect can help you stay as healthy as possible. According to recent studies, every day, estimated 4,000 women will enter the menopausal phase of their lives. For these women, they are ending one journey and just embarking on another one that will be far more demanding and mentally and physically challenging. Menopause today, I want to tell everybody today about menopause, a little bit about menopause, and hope it will help you on your journey someday. That has been a big part of my life so far. A year ago, I had a hysterectomy because of fibroid tumors, and ever since then, I've been going through a lot of different changes in my body. Even though every woman doesn't experience all or any of the symptoms, if you don't experience any symptoms as you go through your menopausal journey, you should know that you're very fortunate. But for those women who have chronic symptoms, as I do, I think you should educate yourself about your body, which can help you to get through menopause healthier and happier. I would like to share with you the way I feel sometimes. I feel as if my body is out of control, and I never know what unpleasant surprise is in store for me. I'm hot and sweating, and most of the day. I wake up in the middle of the night drenched with sweat. I'm annoyed with mental fuzziness while I'm trying to stay focused and on task for the day. Some days it's a constant battle to stay alert because of the wetness, and I'm sleepy because I'm not sleeping at night. And about a year and a half ago, when I had my radical hysterectomy, this is a procedure where they take all the organs out. They remove the uterus, cervix, and both ovaries, both fallopian tubes, and near the lymph nodes in my pelvis. And gradually, since last June, menopause has taken over my body and over my life. I allowed it, at first I allowed it to, and until I started to educate myself about it, I started accepting it as a natural part of life. There is perimenopause and menopause. I'll start with perimenopause. It's a process that leads up to menopause. For some women, it can start as early as your late 30s or as early as your late 50s. How long perimenopause lasts varies, but usually it lasts from 2 to 8 years. Irregular periods can be expected, and menopausal symptoms can occur. Actual menopause is a part in a woman's life when she has not had a menstrual period for at least 1 year. Menopause marks the end of childbearing years. It is sometimes called the change of life. For most women, menopause happens around age 50. Having a hysterectomy, around age 50, but having a hysterectomy can kick you into menopause earlier, even sometimes your 20s, your 30s, or 40s, or some women are still suffering from menopause in their 60s. But for me, my menopause experience was sooner. Some women stop having a period in their late 40s, as I said, and it continues well until their 50s. I started educating myself on menopause and its symptoms. I wasn't actually sure what causes menopause. Through the years, I've heard the words, she's going through change, and she's just hot, and she's moody. And for a lot of years, I thought it meant getting a little hot and fanning yourself, and not having a period didn't sound so bad. So until I educated myself, when the symptoms started, I learned that what actually causes menopause is a normal change in our productive and hormones systems called menopause. As our egg supply ages, our body begins to ovulate less. During this time, our hormonal levels go up and down unevenly. Periods and other symptoms, we have lack of periods and other symptoms. In time, estrogen, which is a class of hormones, the primary function is to influence the female reproductive system's development and function. Estrogen affects the ovaries, vagina, fallopian tubes, uterus, the mammary glands, and plays a critical is crucial in puberty and menstruation, pregnancy, labor, and of course, menopause. Estrogen also influences the structural differences between female and male. Progesterone. Progesterone is another hormone that plays a big part in menopausal journey. Progesterone is a steroid hormone secreted by the female reproductive system. The conditions of the endometrium preparing it to accept a fertilized egg. When the levels of estrogen and progesterone hormones drop enough, then the menstrual cycle stops. That's when menopause occurs and its symptoms. These are some of the symptoms that are mentally and emotionally affecting, most women that have menopause. Some women may experience none or just a few of these symptoms. Some of the symptoms are mental and emotional. You get depressed, you're irritable, you have mood swings, something that I have a lot. Crying spells, emotional outbursts, suspicion of everything. You're always tired. You be tired mostly all the time. Mostly because of not having enough sleep at night, because you're normally drenched with night sweats. And poor memory and a lack of concentration. And the vasomotor problems is hot flashes, which hot flashes affect about 75% of women that are going through menopause. Skin redness, sweating, palpitations of your heart, dizziness, headache, anxiety, faintness, unstable blood pressure, insomnia, irritability, numbness, itchiness, ear ringing, limb coldness, and in the urinary and vaginal changes, you can have discharge or itching, frequent urination, urinary pain, incontinence. The menstrual irregularities include heavy menses, scanty menses, early or delayed periods, prolonged periods, missed periods, and abnormal menstrual flow. And they also can include loosening of the gums, because you're getting older, because these things would naturally probably happen, but being that us women go through menopause, we have a few extra things that happen. The risk of cardiovascular disease, backaches, public and pubic hair becomes thinner and darker, bone loss mass becomes more fragile, hair becomes thinner and loses its luster, breasts droop and flatten, nipples become smaller and flatten. Skin and mucous membranes become drier. Skin develops a rougher texture. Your abdomen, loses some mental tone. Stress or urge incontinence, as I mentioned before, and your vagina sometimes shrinks. These are just some of the menopausal symptoms. There are others. They include like the loss of your libido, meaning your sex desire. Many sleeping disorders, besides the fact that you get a lack of sleep, weight gain, bloating, allergies, brittle nails, changes in your body odor, panic disorder, burning of the tongue, electric shock, digestive problems, and cravings for certain foods. I've interviewed with two women who's going through menopause. And they both agree that making lifestyle changes made menopause happier and healthier. The main point that I got from both women, and I agree totally with them, was the first step to living successfully without menopause was to eliminate as much stress out of your life as possible. Because the more stress you have in your life, the worse the symptoms. The symptoms of menopause are upsetting or uncomfortable. As the first step, you should start developing a lifestyle that's healthy, especially if you're not having a healthy lifestyle. Having a healthy lifestyle can reduce the stress, your symptoms tremendously. Also lowers the risk of heart disease and other long-term problems related to stress and aging. We need to make a special effort to eat well. We should choose a heart-healthy diet that is low in saturated fats, including plenty of fish, fruits, vegetables, beans, high-fiber grains, calcium, and vitamin D can be great for your diet because it helps the bones to stay strong during menopause or just getting older. Getting regular exercise can help manage your weight. Exercise keeps your heart and bones strong. And a great way to lift your mood. Exercise helps to be more emotionally stable. On the other hand, you need to limit your coffee, caffeine intake, alcohol, stress as much as possible. If you smoke, quit smoking. It can reduce hot flashes and long-term health risks. Lifestyle changes, if the lifestyle changes you're having, a healthier diet and exercise doesn't help you and aren't enough for you to relieve your symptoms, you can try other measures such as meditating, which is also called paced respiration. Breathing exercises may help reduce hot flashes and emotional symptoms. Black cohosh, which is a herbal remedy, might be helpful to you, may prevent the relief of a lot of symptoms. But before you try this, you should consult your doctor on how to take this herb safely. Some women feel that eating a lot of soy, even during their menopause, can help their systems. And soy is also good for the bones. Yoga is a great way also to relieve stress. If you have severe symptoms, as I do, they call them chronic symptoms, prescription medication may be for you. They help tremendously with menopausal symptoms. You should always consult your doctor first and educate yourself about what medicines can work for you. Here are a few alternatives. Before menopause, when you're in perimenopause stage, you can use a low-dose birth control pill. It can help with the symptoms. The most popular medication that they give now during menopause is HRT, which is hormone replacement therapy. Hormone replacement therapy is an administration of estrogen and progesterone to women to relieve the symptoms of menopause and to prevent osteoporosis and to reduce the risk of heart disease. Antidepressants are sometimes used for the treatment of symptoms or menopause, but some women are concerned about whether treating menopause symptoms with an antidepressant is safe or even effective. But many women feel as if it's a personal choice to have an antidepressant. And in the medicine, it's called clonidine, that is usually used to treat high blood pressure. It is also used to treat hot flashes. It relaxes the muscle of the blood vessels, causing them to widen or dilute. This reduces the blood pressure flow through the artery. Clonidine the effects on hot flashes is not well understood, but it works in thousands of women. And last but not least, there are thousands of other over-the-counter drugs for menopause. For some who need the relief of hot flashes, mood swings, and other menopausal symptoms, here are the most popular. It's Ambien, Premarin, and progesterone creams. Please consult your doctor before taking any of these over-the-counter drugs and educate yourself about them. All medicines for menopause symptoms have possible risks and side effects. So please consult your physician because all of our bodies are unique and may require different methods of menopause relief. I think that having a positive attitude and accepting the fact that menopause is a natural part of life as we women grow older. A positive attitude can eliminate stress and make menopause manageable, but sometimes it feels like a battle. Menopause, it is a natural part of growing older, and if you are someone or you know someone in this stage in their life, please learn all you can about menopause. Having knowledge and knowing about what to expect can help someone or yourself to stay mentally, physically healthy as possible during the new phase of their life or even your life. As you get older, surround yourself with understanding, supportive people. This can make your menopausal experience much calmer and less painful. In my youth, I did not fully grasp the meaning of growing old gracefully. I definitely know about it now. I mean, it means to be in tune with your body, mind, and knowing how to deal with any adversity, physically and emotionally, with a positive attitude. Robert L. Kine is a PhD, one of the authors of Successfully Aging, explained that successful aging primarily depends on us having positive attitudes and relationships. Successful aging is largely determined by lifestyle choices in diet, exercise, and the pursuit of mental and emotional challenges. Knowing our own self-worth and the involvement we have with others. Thank you.
Woo, that's over with.